It works in very few patients, but the best thing is to do a hysteroscopic cannulation of the fallopian tube, where we put in a telescope inside the uterus and we put in a fine catheter, and this goes into the tube, crosses the block, and then it opens up the tube. Whether the tube is opened up or not, you will see it laparoscopically, and laparoscopy means you make a small cut in the abdomen, 2 tiny cuts on either side, put in a telescope, check the uterus, tubes and ovaries, and here you're going to see whether the tubes are open. So if the procedure is successful, then you will see blue dye coming out of the fallopian tube end, that is called the fimbrial end. But sometimes, at least 25 to 30% of patients, the block is very, very bad, or there are multiple blocks, and therefore you cannot give a successful cannulation. So in these sort of patients, we go in for an in vitro fertilization or an intracytoplasmic sperm injection, the so-called test tube baby technique.
Thank you, ma'am. So what are the other reasons behind infertility?
Yeah, that's a very good question, because it's not only the blocked tubes that are reasons, but polycystic ovaries can cause infertility, chocolate cysts can cause infertility, a very low sperm count or a no sperm count can cause infertility. So these are some of the, then fibroids of the uterus can cause, some blood clots in the muscle of the uterus can cause infertility, and sometimes when they don't have intercourse at the right time, that also can cause infertility. So these are all the many reasons why infertility can set up, and if you ask for it in forms of percentage, then 40% of patients it's because of a low or no sperm count. Low sperm count means normally we expect a sperm count of 20 million, 15% being 50% being moving, it's 15 million, 50% moving sperms with at least 4% having normal structure. If the values are anything less than this, then it is probably because of the sperms. Some people have 10 sperms, 15 sperms, some have 5 million sperms. So all of them, anything less than 5 million, then you probably would require IVF. On the other hand, if the post-wash, that is after you clear up all the abnormalities and the abnormal sperms and the debris and everything in the semen sample, that is called a post-wash count. Anything more than 5 million is you can try an IVF and IUI. Anything more than 7 million, you get better results with IUI, but the best count for doing an IUI will be at least 10 million post-wash sperms. Anything less than 5 million, it is better to go for ICSI or IVF, which means test tube baby, so that you get better results. Instead of wasting too many times on IUI, it's better to go directly for IVF in these sort of patients. Now, if you have polycystic ovaries, almost 15 to 20% of patients with polycystic ovaries also contribute to infertility, and if they have cysts in the ovaries called chocolate cysts, or then this also contributes, at least 10 to 12% of them. And sometimes there are antibodies in the mouth of the uterus, and that is called cervical factor. At least 2 to 3% of them are because of cervical factors. And uterine problems, they contribute to a good 15%, and it could be fibroids, it could be something called adenomyosis, which are small blood clots in the muscle of the uterus, and all these can contribute to infertility. Sometimes everything is normal and still the patient doesn't become pregnant, and that is called unexplained infertility, which is seen in about 8 to 10% of patients.
Then, madam, what is polycystic ovarian syndrome?
See, polycystic ovaries means when you look at the little eggs in the ovaries, the number normally will be 15 to 20. So anything more than 20 numbers is called polycystic ovaries. It could be mild, it could be where there are about 20 follicles or so. It could be moderate, where it could be anything between 20 to 30, and it can be severe, anything between 30 to 70, even 70. Okay, so this is mild, moderate and severe. Now, why is it so important? Because patients with polycystic ovaries, the egg production is very late. There are lots of small little eggs in the ovaries, but they don't grow up to the right size at the right time and release the egg at the right time. Normally eggs grow and it's released around the 14th or 15th day of the cycle, and either you get a period or you get a pregnancy at 28 to 30 days. So in polycystic ovaries, because the egg release is late, everything is delayed, and then cycles come very late, once in 2 months, 3 months, and therefore when you try naturally, you don't know when to plan intercourse. So that is the main